I think it's very simple, you know. When it comes to partners coming together, especially when it has to do with marriage, I think both partners need to take it serious when it comes to genotype. You know, people think they take it for granted, you know, thinking it's nothing. But that thing, it's haunting people. A lot of marriages. I know like few people who have these cases. I think my wife's cousin, the child just died, I think, a few months ago because of sickle cell.
How old was the child?
Oh, I think like 7 years. But they battle with the child, honestly, every day. In fact, to an extent, it caused a lot of problem between she and the husband. Like, I think both of them tried to hide that thing, but at the end of the day, it manifests and it keeps haunting them. So I think partners should be able to take it serious. Genotype is very important when it comes to two partners coming together to build a home. So I think
it's painful. I have friends who have died from sickle cell while growing up. You just wake up and you hear your friend is gone. They had an attack or something, what they call it, and they are gone. They are just gone. Their death is, or it always comes very painful. Yeah.
Okay, so would you choose love? Like, let's say,
I won't. I can't make my children go through pain. There's nothing like love when the offspring that will come from that union is you're going to make your children go through an internal pain, even though there are medications to contain it these days, but it still doesn't reduce the pains that comes from it. So
sickle cell patients are patients that government is supposed to look into, and how government can manage to, you know, solve the sickle cell patients' problem is looking at people, getting in touch with them, and, you know, having some information. Because I'm very sure if you test somebody and you understand what the person is and where the person have challenges in health, so definitely from there you can now know how to go about it, and probably you solve the person issue as well.
Probably most time, but sometimes some people might still know. Probably they felt they are in love, so they go ahead and still do their thing and still get married.
So you now, if you meet a girl now that you're already in love with, and that's one is there, you're going to overlook it, or you'll be praying so that the child stays alive, for example.
Probably I will apply faith. Yeah, I will apply faith.
You apply faith?
Yeah.
No, it means you will go for it.
Yeah, I will go for it.
Wow.
Yeah, but like I'm not just go for it based on applying faith, but like I believe like there are medical researchers that are like working on how to cope that. Yeah, so if I have ample knowledge about how to cope that, yeah, I can go into the relationship.
Okay, so do you think there's enough awareness about?
I don't think.
Why?
I don't think there's more awareness about HIV or maybe sexually transmitted disease than sickle cell. To me, going from rural areas would definitely help the masses. I mean, the government to be able to get in touch to sickle cell patients as well.
So many people, like, it's the ignorance. Maybe they don't check their genotype, they don't know their genotype, and they just got married and they'll have sickle cell, especially if AS, all these genotypes to marry each other, and they may come out having.
So what do you advise people to do?
So what we advise people to do is they should not consider love to cover their face. Check your genotype, do necessary training that you need to do before you marry or before you have children.